So my partner he's LANAP trained, and one of the things that was always very frustrating in residency was that whenever you would try to do GTR, that we frequently didn't really get the results that we wanted. And so LANAP is a nice way to get those results, and I feel that it gets the results similarly to GTR without having to go through the surgery. Overall, I think my patients have been pleased with it. I mean, certainly more pleased than any of the ones I ever did osseous surgery. Well, in the last year since I've been doing LANAP, I haven't seen any of my 1 years yet at this point. And so far I've only seen post-ops, and healing seems to look pretty nice after a few weeks. I have noted that when I have patients that come in and they've been have recurrent abscesses, the tissue is very edematous, it's very rheumatic, that when we are seeing them for their post-ops, that tissue does look much nicer. It looks like the inflammation is resolved, and then they go away for several months, and we don't see them, and we don't hear from them because they're not getting these abscesses. So that's intriguing to me. I have a wonderful woman that I would like to talk about, and she came to me and she was very embarrassed about the state of her dentition and the periodontal disease that had advanced. It had advanced because she had given everything up to be a caregiver for her husband until his death. And she came very apologetic about the way that her oral health was, and she was willing to do whatever it took to get her teeth healthy again. And the worst, and the teeth that had the poorest prognosis were number 7 and 8, I believe. 7 and 8, and then 9 also had a very questionable prognosis as well. And so we discussed just removing those teeth and including those either in the partial or whatever the restorative plan was going to be. But since we were going to do LANAP, we said, hey, why not? They were still testing vital. And so we went ahead and we did LANAP full mouth, and we did LANAP on these teeth. I worked with a prosthodontist to get her in a splint. And as of right now, we are about 8 months. I follow her more closely than I do others. The teeth are still testing vital, and we have seen some evidence radiographic of some regeneration. I have the teeth splinted as well as have an acrylic splint that she wears 24/7 that controls the occlusion, and so I'm not sure regarding the mobility, but they were class 3 mobile, had to be held in while we were doing LANAP was how mobile they were. So my assistant was worried about removing them with her high-speed suction. So they're still maintaining vitality, and we see some osseous regrowth at this point. So I'm very excited to see if this will work for her. For a new graduate who's getting ready to go out and start practicing periodontics, I think the important thing is to realize that there is multiple ways to achieve goals, and I think that LANAP is something that should be considered along with traditional osseous surgery, along with traditional GTR, and I think that LANAP should be an option, something that you offer your patients.